Let's discuss the sung organs, the lung. Key points: the physiological function of the lung, dominating qi and controlling respiration. Free and regulate the waterways. The lung links with all the vessels. The systematic relationship of the lung. Lung is related to the skin in the body constituent and shines in body hair. The lung opens in the nose and produces the discharge. The lung corresponds to sorrow and worry in emotion. Discharge is the fluid of the lung. The lung consisting of two lobes. It is located in the chest. It is compared to the canopy because of its uppermost position among all the viscous. The main physiological function of the lung are to dominate qi, control respiration, smoothen water passage, and assemble vessels. The lung is a place for convergence of blood vessels and helps in charging coordinative activities of qi, blood, and body fluids. The systemic relationship of the lungs with the body are as follows. The lung has an exterior-interior relationship with the large intestine and is associated with skin and constituent, reflects its brilliance in the hair, is associated with sorrow in emotion, with nose in orifice, and with nasal discharge and secretion. The physiological function of the lung. Letter A, dominating qi and controlling respiration. The lung dominating qi and controlling respiration is recorded in Suwen. Lung dominating qi means taking charge of the qi and respiration and operating the qi of the whole body. Taking charge of the qi and respiration. The lung taking charge of the qi and respiration is due to dispersing and descending of lung qi in breathing movement. The lung is the chief organ for exchanging air between the interior and exterior of the body. Human body takes in fresh air and expels waste gas by the lungs' respiratory function. Therefore, to keep the metabolism of the body functioning smoothly. If the lungs' functions are abnormal due to being harmed by external pathogenic factors, respiratory disorder will occur, such as cough, asthma, dyspnea. Next, the operating the qi of the whole body. The lung operating the qi of the whole body can be divided into two aspects. The first is the lung takes part in qi production, especially pectoral qi. The lung performs respiratory function and inhales fresh air from nature. The fresh air inhaled by the lung from the nature forms an important source for the formation of qi in the human body. The second is that the lung regulates qi movement of the whole body. The qi of the lung can be dispersing and descending through the lung qi of the whole body will be ascending or descending, entering or exiting. By activating the flow of qi, lung is able to govern diffusion, dispersion, purification, and descending of qi, as well as regulate the qi of entire body. Next, the free and regulate the waterways. This theory was first recorded in Jing Mei Beilun of Suwen. It refers to the function of diffusion, dispersion, purification, and descent. The lung regulates and controls water passage. Through this dispersion, lung qi disperses body fluids and food essence upward to the face and head, as well as outward to skin and hair. It disperses defensive qi to ensure the closing and opening of the sweat pore to discharge sweat generated after the metabolism. Through descending function of lung qi, water and food essence are transported downward and inward to nourish the whole body, while the turbid fluid generated after metabolism is transported downward to become urine through the urinary bladder. Since the lung is the highest position of viscera and participates in the water metabolism of the whole body, it is known as the upper source of water. If there is a disorder in the function of lungs freeing and regulating the waterways, it will affect the water metabolism, which is manifested as edema, phlegm, and fluid retention. Next, the lung links with all the vessels. Linking refers to gathering, whereas all the vessels refers to all blood vessels in the body. Therefore, lung linking to all the vessels means all blood assembling into the lung through vessels. Through breathing and exchanging turbid qi with clear qi in the lung, abundant blood in clear qi is transported to the whole body, linking with all the vessels in the manifestation of lung governing, dispersing, and descending in blood circulation. Through the lungs dispersion, lung qi disperses blood outward. Through descending function of the lung qi, blood is transported inward and backward to nourish the lung. Therefore, lung qi is able to help blood circulation. The lung linking with all the vessels also means that the lung can promote blood circulation for heart. In clinical setting, the dysfunction of lung qi of dispersing and descending can result in blood stagnation. Therefore, the function of lung includes three aspects. Firstly, it forms qi and regulates movement of qi. Secondly, it regulates water metabolism. And thirdly, it promotes blood circulation. Qi, blood, and body fluids are the basic materials to form and sustain life activities of the human body. If qi, blood, and body fluids are in normal condition, a person will be in a good health. In a broad sense, the regulation of qi, blood, and body fluids of the whole body will all depend on the lung. Therefore, TCM believes that lung governs coordination and is considered the prime minister. Thank you for your attention.
Now let's go to interviewing. Feeling of heat in the chest and palpitations. Excluding external invasions of wind heat, a feeling of heat in the chest is due to full or empty heat of the lung or heart channels. If there is a feeling of heat in the chest accompanied by thirst, insomnia, palpitations, and agitation, it indicates heart fire. If there is a feeling of heat in the evening, dry mouth at night, insomnia, and night sweating, and five-palm heat, it is due to heart empty heat. A feeling of heat in the chest accompanied by a cough, hot hands, a red face, and an expectoration of yellow mucus is due to lung heat. If it is accompanied by night sweating, a feeling of heat in the afternoon, five-palm heat, a dry throat at night, and a dry cough, it indicates lung empty heat. A feeling of heat in the chest is an invasion of external wind heat and is aversion to cold, fever, and sore throat. When it's heart fire, there is insomnia, palpitations, a red tip of the tongue. And with heart empty heat, it's insomnia, night sweating, dry mouth at night. And lung heat is with a cough and red face. In lung empty heat, there's dry cough, night sweating, dry throat at night. When we ask patients about palpitation, it is important to explain to them that the meaning of the symptom most patients mistakenly identify palpitations with is tachycardia, that is, a pulse beating faster than normal. In reality, palpitations are not related to the rate or speed of the pulse, but simply indicate a subjective and uncomfortable sensation of being aware of one's heartbeat. Palpitations are a symptom which is always related to the heart and may appear in any of the heart patterns. Palpitations with an acute onset may be due to external stimuli such as a fright or an overwhelming emotional upset, in which case it is called fright palpitations. Palpitations that extend upwards towards the chest and throat and downwards towards the umbilicus and abdomen are called zhengchong, which is translated as panic palpitations. Literally, it means panic and anxiety. This type of palpitations is due to rebellious qi in the penetrating vessel, affecting the heart, and is considered a more severe type than ordinary palpitations. Thank you for listening.
Diagnosis according to sheet qi, phlegm 3. Symptoms and signs. fatigue that is worse in the morning, difficulty getting going, and being mentally absent in the morning, increased need for sleep, lack of appetite, especially in the morning, nausea or vomiting, heaviness in the chest, cough in the morning. The sputum can be loose or sticky depending on whether or not there is heat present, shortness of breath, dizziness, heaviness in the head, glazed vision and dull eyes, sleep in the eyes, dark, sooty color around the eyes, depression, melancholy, mental confusion, and difficulty thinking, especially in the morning, incoherent speech or talking to themselves, difficulty concentrating, skin and flesh tissue can lack tone and be doughy, and the skin lacks luster. The fingers can be thick and chubby, increased growth of body hair, tendency to obesity and plumpness, symptoms and signs that are triggered or provoked by weather changes, perfume, petrol, or solvents, symptoms that are provoked by consuming phlegm-producing foods and beverages, numbness, greasy or oily skin and hair, sticky taste or sensation in the mouth, thick saliva or saliva in the mouth, mucus in the menstrual blood, fibroids and nodules, fat nodules under the skin, deformed joints, heavy sticky odor, repeated need to clear the throat, gravelly or nasal voice, swollen tongue, a tongue that lacks tone, sticky or greasy tongue coating, slippery or wiry pulse. The key symptoms: fatigue and mental absence in the morning, lack of appetite in the morning, sticky sensation in the mouth, symptoms and signs that are triggered or provoked by weather changes, perfume, petrol, or solvents. Treatment principles: transform and drain phlegm. Acupuncture points: choose from stomach 40, stomach 36, REN 12, spleen 3, spleen 6, spleen 9, UB20, and UB21. Needle technique: drain stomach 40 and spleen 9, tonifying on the rest of the points. The explanation: stomach 40 drains phlegm, spleen 9 drains dampness, spleen 3, spleen 6, stomach 36, and REN 12, UB20 and UB21 tonify spleen chi and transform phlegm. The relevant advice. The relevant advice will depend on which individual patterns have been involved in the creation of phlegm. Nevertheless, there are some general guidelines that are relevant for all individuals who present with phlegm imbalances. Diet is very important, and the patient should avoid foodstuffs and beverages that produce dampness and phlegm. This will include avoiding dairy products, bananas, sugar, things that taste sweet, such as dried fruit, honey, stevia, so on, wheat, fried food, and alcohol. Nuts are interesting in this context because eating too many nuts creates phlegm, but eating small amounts of almonds or walnuts can transform phlegm in the lung. In general, a person with phlegm will benefit from eating foods that have a slightly spicy flavor, such as watercress, radishes, turnips, daikon, garlic, pepper, herb, and so on. It is also important that they do not eat too much at a time and do not eat too late in the evening. Physical activity and movement are important to counteract phlegm's tendency to stagnate. Phlegm can be caused by the following pattern imbalances: spleen qi shu, lung qi shu, dampness yang shu, yin shu, heat, cold, qi stagnation, shui. Phlegm can result in the following patterns of imbalances: heat, qi stagnation, shui stagnation, spleen qi shu, lung qi shu. Thank you for your attention.
Diagnosis according to 4 levels: Hui level, damp heat. In this pattern, there is an invasion of damp heat in the Hui level. This is equivalent to invasion of damp heat in the upper jiao in diagnosis according to Sanjiao. Damp heat is heavier and more obstructive than wind heat. This will result in aching and heaviness of the limbs. Dampness can block the sweat pores, so there is no sweating, or the heat can make the sweat sticky in consistency. Because there is impure yin in the head and a lack of pure yang, the headache in this pattern will feel heavier than the one felt in the wind heat pattern, and the person will have difficulty thinking clearly. Damp heat can also block and disturb the movement of qi inside the body, resulting in poor appetite, nausea, and chest oppression. There may be diarrhea or constipation depending on whether dampness or heat is a dominant aspect. Etiology is exposure to damp heat pathogenic factor. Signs and symptoms: fever, worse in the afternoon, nausea, aversion to cold, heavy and aching limbs, poor appetite, abdominal bloating, heavy headache, chest oppression, lack of sweating or sticky sweat, fatigue, diarrhea or constipation, greasy yellow tongue coating, fast and slippery pulse. Key symptoms: heavy headache, heaviness of the limbs, rapid and slippery pulse. Treatment principle is to expel and drain damp heat, activate Wei Qi. We can choose from the following acupoints: 214, Li4, Li11, lung 7, spleen 3, spleen 9, Ren 12, and pericardium 6. Needle technique is draining or sedation. Do14 drains heat and activates Wei Qi. Li4 and lung 7 activate Wei Qi and expel exogenous pathogenic factor. Li11 expels exogenous pathogenic factor and drains damp heat. Spleen 3 and spleen 9 drain damp heat. Ren 12 and pericardium 6 regulate the Qi in the middle and upper jiao. The person should avoid consuming food and beverages that create damp heat. In general, it is best not to eat or to only eat light meals when there are invasions of exogenous pathogenic Qi in the interior. An invasion of damp heat can be caused by damp heat, or there can be no previous pattern, and an invasion of damp heat can result in Qi level heat, Yin level heat, damp heat, and spleen Qi deficiency. Thank you for your attention.
Let's proceed to combining points principles with balancing upper and lower parts of the body. The channel system forms a closed circuit of energy circulation with a maximum potential of energy on the head, minimum on the chest, and average on the hands and feet. In order to maintain the balance between the upper and lower part of the body, it is important to balance the chosen points between these two areas. After a needle is inserted in a point, it tends to cause a rush of energy towards the top of the body, particularly for the points at the opposite end, that is, the lower parts of the body. This movement of Qi is irrespective of the channel's direction of flow. Keeping this in mind, it is important to balance the points on the upper part of the body with those of the lower part. An example of point prescription balancing upper and lower part of the body might be Li4 and liver 3. These points are called the four gates. This combination clears wind from the head and has a powerful calming effect. Another example might be the combination of pericardium 6 with stomach 36. Pericardium 6 harmonizes the upper and middle part of the stomach and subdues rebellious Qi, which causes nausea and vomiting, while stomach 36 tonifies stomach Qi. The combination of these 2 points provides a balanced tonification of stomach and spleen and can be used in many epigastric problems. Here is an illustration showing the left and right combination of pericardium 6 and stomach 36, where pericardium 6 is needled on the right arm and stomach 36 on the left leg. Another example might be the combination of triple burner 6 with GB31. These 2 points clear wind heat from the blood and can be used for herpes zoster or any skin diseases manifesting with a red and itchy rash that changes position rapidly. This combination would be particularly effective if the flanks are affected. Here is another illustration showing the left-right combination of triple burner 6, which is needled on the left forearm, and GB31 on the right thigh. Balancing upper and lower parts of the body achieves a particularly dynamic effect when it is combined with the balancing or of yin and yang and left and right. For example, this is achieved by using pericardium 6 on one side with stomach 40 on the other. Of course, there are numerous examples of achieving a balance by using upper and lower points together. such combinations are frequently used. However, this does not mean that one should always balance upper with lower part. In some cases, one might deliberately want to choose an unbalanced point prescription to obtain a specific effect. For example, if there is an imbalance of energy between the upper and lower part of the body with a very red face, hypertension, dizziness, anxiety, insomnia caused by deficiency of kidney yin, which is deficiency below, and the rising of liver yang, which is an excess above, one might choose to needle only kidney 1 in order to draw the excess qi on top downwards. On the other hand, if a woman suffers from prolapse of the uterus, the sinking of spleen qi, one might deliberately use a point on the upper part of the body in order to draw qi upwards. For example, moxibustion on Baihui or dose 20. In both cases, the channel system dynamics is exploited to draw the energy to the upper or the lower part of the body. There is another case in which the principle of balancing top with bottom is not applied. This is when a distal point is reduced in acute cases of sprain of the back or a joint. For example, one can strongly reduce the point D26 for acute sprain of the lower back on the midline over the sacrum. Thank you for your attention.
Let's discuss diagnosis according to some organ patterns. The stomach yin deficiency. Stomach yin deficiency. It is important to remember that this pattern is often seen in combination with other patterns, such as spleen qi deficiency or spleen yang deficiency. This means that some of the symptoms and signs will not be as obvious because they are veiled by the symptoms and signs of the other pattern, and vice versa. Theology: eating regularly and eating late in the evening and eating while working or stressed will all injure the stomach yin. An excessive consumption of spicy food and food that is hot in its energy can harm the stomach yin. Some medicines will also have an energy that endures the stomach yin. There may be a congenital tendency to have stomach yin deficiency. Invasions of exogenous pathogenic qi can penetrate the qi level or create heat in the yang min organs. This excessive heat can injure stomach yin. Heat from the liver can damage stomach yin over time. For the symptoms and signs, there is a poor appetite, constipation, dry mouth and throat, especially in the afternoon and evening. There's dry stool, dull pain, slight burning sensation or discomfort in the epigastric region, thin body, dry tongue with cracks or lacking coating. In the middle, the coating on the tongue can be rootless. Fine, empty, or superficial pulse in the right guan position. When there's stomach yin deficiency heat, there can also be a fever or a feeling of heat in the body in the evening and at night. Hot sensation in the palms of the hands and soles of the feet. Restlessness at night, night sweat, bleeding gums, a slight thirst with a desire to sip only a small amount at a time. Red and dry tongue or a tongue that is red in the middle. The tongue may lack coating and have cracks in the middle. Rapid, fine, or empty pulse, especially in the right guan position. The key symptoms, there is dry mouth and throat, dry stool, discomfort in the abdomen, dry tongue that lacks coating in the middle. The treatment principle is to nourish stomach yin. For the acupuncture points, choose from stomach 36, spleen 6, Ren 4, Ren 12, kidney 3, kidney 6, UB 20, and UB 21. The needle technique is tonifying. For the explanation, stomach 36, spleen 6, Ren 12, UB 20, and UB 21 nourishes the stomach yin. Ren 4, kidney 3, kidney 6 nourishes kidney yin, thereby supporting stomach yin. When there's stomach yin deficiency, it will be beneficial to eat foods that are wet and sticky. Things such as pork, porridge, puree soups, and stews will therefore nourish stomach yin. Foods that are dry in their consistency or in their energetic dynamic will do the opposite and have a negative effect on the stomach yin. Foods that are drying in their energy are those that are very spicy. The spicy taste disperses and dries, or have been baked in the oven for a long time. This means that the person with stomach yin deficiency should try to avoid crackers, rice cakes, toast, baked vegetables, and similar items. Deep fried and grilled foods have a very hot energy, and this can also endure stomach yin. Alcohol, too much meat, especially the lamb, and spices such as chili, garlic, pepper, and so on, all have a hot dynamic, which can damage stomach yin in the long term. Apart from being aware of what they eat, a person who is stomach yin deficient should pay close attention to how they eat. They should try to eat in as tranquil surroundings as possible, which means that they should not eat while working or driving, when they are stressed, or while they are doing something else. They also need to rest and not exert themselves after they have eaten. They should not eat late in the evening, and they should not eat too much at a time. The stomach yin deficiency can be caused by stomach qi deficiency, stomach fire, and liver fire. Stomach yin deficiency can result with the kidney yin deficiency, spleen yin deficiency, heart yin deficiency, liver yin deficiency, lung yin deficiency. For the summary, in the stomach yin deficiency, the etiology is eating late at night, skipping meals, eating on the run, worrying while eating. The underlying or accompanying pathology, stomach qi deficiency, spleen qi deficiency, spleen yin deficiency. Kidney yin deficiency, stomach heat, fire or damp heat. For the signs and symptoms, poor appetite with little desire to eat, constipation, dull, epigastric discomfort or pain, dry lips, mouth, and throat, especially in the afternoon. Slight feeling of fullness after eating, thirst, dry stool, dry scant urine. For the pulse, it is floating and empty on the right middle position, rapid, fine. For the tongue, it is peeled in the center, possible midline crack. Treatment principle is to enrich stomach yin, harmonize the stomach. Acupuncture treatment, we use Ren-12 to supplement stomach yin, stomach 36 to supplement stomach qi and yin, spleen 6 supplements stomach yin, nourishes fluids and clear empty heat, spleen 6 nourishes yin, clears empty heat, bladder 21 supplements stomach and spleen qi, stomach 44 harmonizes the intestine, kidney 6 nourishes yin, spleen 3 nourishes fluids, bladder 20 supplements spleen, stomach 25 stops diarrhea, regulates intestine. We needle with supplementation. Thank you for your attention.
Now let's talk about diagnosis according to Qi, Shui, and Jingyi imbalances. Blood deficiency, or Shui Shu. When there are blood imbalances, there will be observable disturbances in one or more of the functions performed by blood in the body. It will either be because there is too little blood to perform the function, like blood deficiency, or because blood has stagnated and therefore cannot fulfill its functions. Stagnations of blood will also prevent the free passage of qi, blood, and jinye, and this will often result in pain. Blood can also become too hot, and there can be a physical loss of blood through bleeding. As we saw with qi deficiency, there can be a general condition of blood deficiency with accompanying signs and symptoms, as well as a blood deficiency condition in specific organs, liver blood deficiency and heart blood deficiency. The main function of blood is to nourish and moisten the tissues of the body and to nourish and anchor Shen. This means that when there is a condition of blood deficiency, any of the following signs and symptoms can be experienced. The skin, especially the skin in the face, can be pale, sallow, and dry. This is due to a lack of moisture and nourishment. Shen is anchored and thereby circulates together with blood. Blood deficiency can therefore also result in the complexion lacking luster and radiance. The lack of nourishment and moisture can also manifest with dry hair, ridged or brittle or soft fingernails, pale and dry lips. The hair can also be very fine there can be a tendency to lose hair due to the hair roots lacking nourishment. Dizziness is often seen when there is blood deficiency, especially when the person gets up from a sitting or lying position. The dizziness arises because the brain lacks nourishment. The brain's lack of nourishment can also manifest as a poor memory. This is, for example, a common complaint of women whilst they breastfeed their baby. The breast milk is produced from blood, so there are often blood deficiency as a consequence. When there's blood deficiency, there can be insufficient blood to nourish the extremities. Shen is anchored by blood and thereby circulates together with blood. The lack of blood in the extremities can therefore result in numbness, sensory disturbance, and tingling sensations in the extremities. There can also be muscle cramps in the legs in the evenings when blood returns to the liver. The eyes are nourished by liver blood. A person who is blood deficient can have poor vision, especially at night, difficulty focusing their eyes when they are tired, spots in front of the eyes, and the sensitivity to bright light. Women who are blood deficient will often have scanty menstrual bleeding or even amenorrhea. If there is heart blood deficiency, there can be palpitations as well as insomnia, anxiety, or a sense of unease and nervousness. This is because Shen is not being anchored and nourished by blood. The tongue will be pale, thin, and dry because it is not saturated by blood. The pulse will be fine or choppy. There are three main causes of blood deficiency. There may be an inadequate intake of food that creates blood, and there may be a deficiency condition in one or more of the blood producing organs, such as the spleen or kidneys, or there may be loss of blood through bleeding or because it is consumed by mental or physical overactivity. The symptoms and signs are pale or sallow complexion, dry skin, dry and pale lips, dry hair, hair loss, fine thin hair, numbness, tingling sensations of sensory disturbance in the arms and legs, and dizziness. There's also poor memory, visual disturbances, spots in the visual field, night blindness, difficulty focusing the vision, sensitivity to bright light, rigid, soft, or brittle fingernails, palpitations, insomnia, nervousness or anxiety, scanty or absent menstrual bleeding, thin, pale, and dry tongue, fine or choppy pulse. The key symptoms: pale, sallow complexion, dry skin, scanty menstrual bleeding, dizziness, fine and choppy pulse. The treatment principle is to nourish the blood. The acupuncture points to choose from are stomach 36, spleen 3, spleen 6, Ren 4, Ren 12, urinary bladder 17, UB 20, and UB 21. The needling technique to be used is tonifying, and moxa is recommended and should be used on UB 17. So UB 17 nourishes blood. Stomach 36, spleen 3, spleen 6, Ren 12, UB 20, and UB 21 tonify the spleen and thereby the production of blood. Ren 4 nourishes Jing and thereby blood. For relevant advice, it is important that a person who is blood deficient eats a diet that is rich in foods that nourish blood, such as red meat, chicken, liver, green leafy vegetables, beetroot, seaweed, dates, nettles, aduki beans, kidney beans, and black beans. Furthermore, they should eat a diet that tonifies spleen qi. Blood deficiency can be caused by the following patterns of imbalance, like blood loss and spleen qi deficiency. And it can result in spleen qi deficiency, blood stagnation, and yin deficiency. Thank you for your attention.
Depression, Case History 3. A 48-year-old man had been suffering from depression for over 10 years. He was successful in his profession, but in the last 10 years, he felt increasingly dissatisfied and questioned the meaning of life. He was happily married and had no financial problems. His depression manifested with a low mood, a sense of frustration and irritability, a lack of drive, and a feeling of pessimism. From the physical point of view, he had a few problems, but he did suffer from lower backache and low libido. His pulse was wiry but empty at the deep level. His tongue was reddish purple on the sides and had a deep heart crack. After seeing the deep heart crack on his tongue, I asked him some more questions about his depression and personal history. A deep heart crack on the tongue always indicates that the person had either been subject to severe emotional stress for many years or that he or she has a family history of mental emotional problems. When I asked this patient about his family and personal history, he said that his father had suffered from depression for many years when he was a child and a teenager. His memories of his father were of a man who was in a grip of major depressive disorder and hardly ever left his bedroom. This had affected him deeply, although he himself did not realize this. Therefore, the deep heart crack reflected this situation. The clinical significance of a deep heart crack also concerns prognosis. In fact, such a crack always indicates that results will be slower to come. Diagnosis. His wiry pulse and the sense of frustration and irritability indicate liver qi stagnation. As the sides of the tongue were purple, this indicates that the qi stagnation has given rise to blood stasis. The stagnation of liver qi and liver blood contributes to the depression as they restrain the coming and going of the ethereal soul. The emptiness of the pulse at the deep level, lower backache, and low libido indicate a kidney deficiency. The kidney deficiency induces a weakness of willpower and therefore a lack of drive and enthusiasm that contributes to the feeling of depression. Treatment. The treatment adopted was to move qi, soothe the liver, invigorate blood, and tonify the kidneys. I used primarily acupuncture and some three treasures remedy. Bladder 23, Sen Shu, Ren 4, and bladder 52 to tonify the kidneys and strengthen the willpower. Liver 3, bladder 47 to move liver qi and invigorate liver blood and stimulate the coming and going of the ethereal soul. Heart 7, Heart 5, and Ren 15 to nourish the heart. Du 20 and Du 24, Shen Ting to lift mood. I treated this patient with acupuncture only once a month because he lived a long way away. He started to improve after 3 months of treatment with acupuncture and the herbal remedy. After 18 months, he felt a lot better in himself, and he was not feeling so frustrated and dejected, and he felt much more enthusiastic about life, so much so that he found the mental drive to make a radical change in his career. A deep heart crack such as the one he had cannot completely disappear, but it did get less deep. Thank you for listening.